Brain surgery is sometimes performed while the patient is awake, and this is done to help surgeons avoid damaging critical brain areas.
Now, this is known as awake craniotomy, and it's a surgical procedure where patient remains conscious during surgery. And the purpose of this is allowing surgeons to monitor, observe, and preserve critical functions like movement, speech, and vision.
You see, they'll ask the patient to perform tasks like speaking or moving their arms. And by directly observing their responses, surgeons can precisely navigate around crucial brain regions, ensuring essential functions remain intact.
So this is true. The surgeons use gentle electric stimulation to observe important areas as they ask the patient to move, to talk, or respond to simple commands. And this helps them to operate only on targeted area and preserve important areas so that the patient doesn't lose these important abilities after the surgery.
A doctor can make an incision on your neck if you can't breathe, carefully cutting all the way through the skin and fat underneath. They'll move and reposition the thin muscles and connective tissue that surround your windpipe.
Now, this is called tracheostomy, and it's a surgical procedure that creates a new airway through a hole in the neck directly into the trachea, and it's performed to help someone breathe when their normal airway is blocked. So they make a careful cut in the neck, go through the skin and fat layer until they reach the windpipe.
And finally, they make an incision in your trachea and insert a breathing tube. This causes the air to bypass your blocked throat, allowing you to breathe.
So this is true. This part actually describes the opening of the windpipe, where a breathing tube known as tracheostomy tube is inserted into the opened windpipe. So once this breathing tube is inserted into the opening, it allows air go directly into the person's lung, bypassing the blocked throat. So with this, the person can actually start breathing immediately again.
He milked the venom from the snake before injecting it into his veins, but it was such a small amount that he was unharmed, and this allowed him to build up antibodies. Over the next 20 years, he did this 700 times, injecting more and more venom, and eventually he built up a tolerance. He's now been bitten over 200 times by some of the world's most deadly snakes, and he's survived each one.
Injecting venom directly into the bloodstream is normally dangerous due to toxic protein and enzymes, but if the dose is extremely small, the body may neutralize this toxin before they cause serious harms to the body. And these venom proteins in the bloodstream are recognized as foreign antigens by the body immune system, and the response of the immune system is that these antibodies, they are antibodies that are produced to block the venom activity. And once this process is repeated, it is called induced immunity, where the immune system builds up tolerance to neutralize or resist the venoms at levels that could kill an unprotected person.
Eventually, his blood could be used to create a universal antivenom, saving people from all kinds of snake bites.
When your body now have antibodies against many different snake venoms, your blood could therefore be used as an universal antivenom, but this could require purification and careful testing, so I do not recommend this.
If your eyes point in different directions, a doctor will make a tiny cut in the thin covering of your eye. Then they'll lift the exposed muscles from the eyeball, moving them slightly to help your eyes line up straight.
Now, this is called strabismus, and it happens when your eyes don't align properly and they work in different directions due to imbalance in the eyes muscle. And so what the surgeon does here is to cut a very small part of your conjunctiva and adjust the muscles that are holding the sclera.
Once they're in the right spot, the doctor stitches the muscles firmly into place so they stay aligned.
So here the doctor adjusts the muscles a little and stitch the muscles where they should stay so that the eyes can remain straight.
Finally, they close the tiny opening on your eye with small stitches that dissolve over time. And once it heals, your eyes stay aligned and point in the same direction.
The stitches melt away on their own, so there is no need to remove it later, and this gives the eyes a very straight and balanced walk.
When your umbilical cord is cut, the tissue inside the hole can sometimes protrude outwards, which results in what's known as an outie belly button.
This is known as the first type of outie belly button, and this happens when the umbilical cord is cut off by the doctor after birth, and the scar tissue from the cut then heal outwardly, making a little bump that creates an outie belly button. But in some cases, it heals inwardly, therefore resulting to an innie belly button.
But even if the tissue does heal inward, at any point in your life, your intestines could push through your abdominal muscles. This is known as an umbilical hernia and also causes an outie belly button.
This is the second type of belly button, and it is caused by what we call umbilical hernia. This is where the scar tissue originally healed like an inner belly button, but later in life, pressure from intestines then pushes through the weak spot located on the abdominal wall, which is the belly button, and making it bulge out and turning into an outy belly button.